Well, let's go ahead and get started then. I'll call this meeting to order. Still don't have my gavel, which is a good thing. Too much noise. I'm just reminding you that we are still operating under the resolution adopting procedures for public meetings that we made on the 18th of May at that meeting. Are there any comments or questions about the minutes from the last meeting in June? Do I have a motion to accept those?
I so move.
Thank you, Kathy. How do you want to run the vote, David? Shall I just run through the list the way it's on my screen? Or?
That's fine. Yeah, roll call that.
Right. You're not going to be in any kind of order because you're going to be in the order that's on my screen. And Mike, you weren't at the meeting as a board member.
Correct.
Wendy?
Yes.
Kathy?
Yes.
Erica? Yes. Jim?
Jim is muted.
Jim, can you unmute? You're still not unmuted, Jim.
Try it now.
There you go.
Okay. Yes.
Thank you, and I'll vote yes as well. All right, are there any announcements to be made?
I would just like to thank Michael for jumping back in. I hope you have all those policy notes still ready to go. Okay. And it's good to see you again.
Thank you. I appreciate it.
I second that.
I think you would get a very positive vote there, Michael. Any other announcements? Wendy, is there something else?
Oh, no, I'm sorry.
Okay.
I'm sorry.
All right. Any public comments?
I have one to be read into the record, Marcy, if that's okay.
Yes, of course.
This is from former trustee Gary Grant, and it's about the vote that you all are going to make this afternoon on the schedule of library closings. Gary says, I support the first option, version A. Additionally, while I am not a military veteran, I would never support eliminating the Veterans Day holiday to add a different holiday in its place. Please provide my input to the Board of Trustees, at least verbally. And that's it.
Thank you.
And then do you want Sarah to see if there are any?
Could she please? That would be great.
Right now we don't, but for the attendees, if you either raise your hand or put something in the chat or the Q&A, I can read it out to the board. So we'll give you a minute maybe to decide how you want to flag us down.
So we'll just take a brief pause to see whether anyone wants to put a query or make a comment.
And Sarah, if they're on a phone to raise your hand,
If you're on a phone, if you star 9, you'll be able to, or if you swipe to the right, you'll get the screen that will allow you to ask a question. There's instructions on that. So far, there's nothing that's come in.
Okay, we will take that as an empty comment period. There is no trustee continuing education for this week because of the format of the meeting and the amount of business that we need to cover. I do hope that you all have paid attention to the emails that do come across from VLA and ALA, though, that offer webinars and recorded sessions that might be of use to you as trustees. It's a lot of email that we get from them, but I think there are some useful sessions there, and I hope that you're paying attention to those. We'll go on to new business. David is going to talk about the COVID-19 response plan and our optimistic plan for opening a bit the libraries.
Okay, thank you, Marcy. So I'm gonna kind of go through a little bit of a history of what JMRL has done in response to COVID-19, and then share the plan with you all, which is in your handouts, and I hope everybody had a chance to review. So Tier 5 of JMRL's COVID-19 response lasted from March 16th until May 26th, and that was physical buildings closed entirely. At that point, all programming and services that JMRL offered were entirely virtual. In our previous meetings, I've talked about how many virtual cards got made. Catherine told me today that we are over 1,000 virtual cards that have been made since that date. And of course, our overdrive circulation is, not just overdrive, but all the digital materials are through the roof compared to years past. On May 26th, JMRL stepped down to Tier 4. So when we started with the process, it was at Tier 0, and we moved up to Tier 5, which was closed. We're now in Tier 4, which we went into on May 26th, which is providing curbside and drive-up service 5 days a week, 4 hours a day. The response from the public has been overwhelming, literally overwhelming. The Northside Library is struggling with over 4,000 holds on their hold shelf currently, or the other day at least, and sometimes up to 1,000 things to pull every day to meet demand there. So if nothing else, we need to look at expanding that service some. Originally, JMRL had planned for a move to Tier 3, which is some limited in-building service on July 6th, which was kind of in conjunction with the state's move to Phase 3 of the Forward Virginia plan. That version of Tier 3 service included very limited in-building hours and buildings open at 50% capacity. So it was closer to the governor's Phase 2 of what was allowed. This move was postponed for two weeks in consultation between myself and the board president due to capacity issues mostly. So we had lack of a reliable delivery between libraries, delays in getting PPE and cleaning supplies to branches, and time needed to finish the physical preparation for library spaces. So at that point, we delayed for 2 weeks, and the plan was to move to Tier 3 on July 20th. The Emergency Planning Committee worked on the original plan for Tier 3 for quite a long while, shared it with all staff, and sent out an anonymous feedback form to staff to get input on that plan. It was filled out, received responses from more than 75% of staff, so it was very well, they really paid attention to it. Most of the responses expressed significant concern about the ability for staff to limit their exposure in an open building while also maintaining 50% capacity and policing masks for the public. Additionally, local trends for percent positivity and new COVID-19 cases were going up. So again, in consultation with the board president, we delayed a move to Phase 3. At that point, the Emergency Planning Committee reworked the Tier 3 plan to what you all have before you in your packet, incorporating staff feedback and further limiting the services that would be offered. In consultation with the board president, we decided to bring this to the full board for a vote on moving forward. So to date, we have been following JMRL policy 5.3, which is emergency closing. And per that policy, it's the library director's decision about closing branches in an emergency, saying that the guide is to follow the local county office buildings for each jurisdiction. I think we have moved beyond that. It was not intended for this length of an extension. So board input and direction is needed at this point in order to acknowledge the increased risk that we're going to ask staff to take by opening the buildings up. Okay, are there any questions about the process to this point? If not, I'll share my screen with the plan and we can talk about the specifics of it.
Just a quick question. So what is your goal from the board today? Is it a vote on the plan, or possibly with modifications?
Yes.
That's what you're looking for. Okay.
That is the goal. Yes.
Great,
At this point, the staff have reviewed the plan. They got it last week. We received some feedback. The managers discussed it this morning. But we're looking for the support of the board for a move to in-building service. Okay, any other questions before I share my screen?
David,
Yes.
how do you want us to handle comments and queries to you?
Throughout this?
What, do you want to wait until you get to stopping points, or do you want to go as we go point by point down the list?
I'm fine with questions as we're going.
All right.
That's fine with me. As long as it doesn't become too cumbersome, you let me know if it's too cumbersome and we can hold them for the end.
Okay.
Okay. Okay, does everybody see my screen?
Yes.
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 Okay, pardon the fast scroll while I move through the agenda, minutes. And our tier 3, express appointment service and curbside drive up. So library buildings, per this plan, will be open to the public by appointment only. Buildings will initially allow 5 people for 45-minute appointment slots on the hour, allowing staff for 15 minutes to clean in between. So appointments will be made for essential computer use, browsing, copying, scanning, faxing services. 1 appointment per day per person, and appointments can be scheduled up to 7 days in advance. The goal here was to pilot this project. We can talk in a minute about timing for it, but pilot the reopening, start very small, prove that we have capacity and safety measures in place in order to be able to handle this, and then reevaluate potentially at the end of a 2-week period or longer to see if there's more capacity at some locations. Some of our bigger buildings might be able to take more. Okay, so not much has changed between the original tier 3 for this first section here.
David, could I ask you a question about priorities here? Browsing the stacks, is that a big priority for you?
Yeah, I believe it's one of the major services that we can't replicate virtually for the public. So it is a priority for me to allow the public to have access to our collection.
And you feel it's worth the risk?
Personally, I do feel that, yes.
David, can I ask a question?
Sure.
Is there a plan to, what is the plan to deal with books that may have been touched by people browsing that they didn't take? I know you're letting return books sit, so.
Right. Yeah. Currently, we're going to have cleanup after each browsing section, but it would not involve cleaning those books. Staff would be monitoring the areas that would have high touch frequency. One of the options that's been discussed is to have a quarantine cart out, but otherwise there was no plan to quarantine books that had been touched during browsing. Any other questions so far?
I think that's a little bit of a contradiction. I think the idea of a quarantine cart might be a good one to think about for the first opening, just because in any of our libraries now, with the exception of Scottsville, I think there's probably too much area to cover for staff, given that, especially in the North Side library and maybe in Crozet, curbside service has been requiring so much hands-on work and time that it's going to stress the staff even more to try to keep an eye on where people actually are.
Well, I think they're going to need to keep an eye on where they are in order to avoid close contact, but I think that's kind of a separate issue from the materials themselves. This is certainly something that the Emergency Planning Committee has talked about at great length and fell down on the side of not quarantining those materials, but it's something that could be done if the board feels that that's a necessary precaution. We could certainly do that at each branch. I think Nancy had her hand up.
Yes, could you not just provide gloves for those people? They can wear gloves if they're going to browse the shelves, and as they come out, they can take them off.
But a concern there is you're going to need staff to police them because everybody may not do it.
Yeah, the masks, we have pretty strong backing from the state and our localities. I think this afternoon, the Charlottesville and Albemarle are having meetings to talk about potentially more strict mask requirements. So basically, it's no mask, no service at this point. We'll talk more about that a bit later. But for gloves, that would be a bit trickier. We could make them available, but I think a quarantine cart, if there are concerns about this, a quarantine cart is probably the best way to go.
Okay.
I'm sorry, this is Carla. So some of the store, if we look at it like a retail type setting, where you have people touching a lot of different things, they just request hand sanitizer when you enter the building. Now, I just had an instance where I was required to wear gloves, but they didn't require the hand sanitizer, which I thought was interesting. And so this is stores where you are touching things quite a bit, and possibly putting them back on the shelf.
Okay, I'm either reading something incorrectly. So if the if the appointment only, and you have 5, how many people are in each of the buildings? Each of the libraries?
How many members of the public?
Yeah.
5 at a time to begin with here. 5 per hour. So at 10 o'clock, 5 people
Right.
will be allowed in for 45 minutes. At 11, 5 people will be allowed in for 45 minutes.
With the exception of Scottsville.
Yes, and Gordon
Right.
Avenue, looking at
Gordon
3.
Avenue. Right.
Okay, so, and that is not just for computers.
No, that's correct. It's full.
That, okay, so that's the browsing. Okay, so I'm trying to figure out how, if you can monitor 5 people with gloves, or as Carla said, with hand sanitizer.
Well, we'll have hand sanitizer available for the public. We're waiting on some supplies for the stand. Some of our branches have you walk in and there's a stand with hand sanitizer. Not all of them had that prior to COVID-19, and Jerry ordered them in March, and we're still waiting for those, but there will be sanitizer available. Okay, so it sounds like this is a point that the board would like the emergency planning committee to address, the browsability and whether or not to require either gloves or a quarantine cart at each location. Does that sound right?
Yes,
Okay.
I believe so.
So the first part of the information for staff here is about scheduling, what their schedules are going to be. They're still pretty varied in order to keep social distancing in the branch. The goal here is to have equity in scheduling. So if full-time employees are coming in full-time, part-time are coming in part-time, but if full-time are coming in 3/4 of their time to work in the building, then part-time are also half-time are also 3/4 of the time there. There's some information here for staff about the potential extended leave that's available from the federal government.
No, Lord, here I go again.
I had a concern, David, about the second point under PPE for staff.
Yes.
You said there was an exception for an individual alone in a room behind a closed door in terms of masking.
Yes.
Does that mean in your own private office, or does that mean in a room where you are the only occupant at that time?
I believe in the room where you are the only occupant at that time.
Now, why is that a good idea if other people will also be using that room?
Well, we need a space for staff to be able to drink water, eat, things like that, where they're going to have to remove their masks. And
Yes.
Unfortunately, we don't have, dedicated rooms for each individual in order to do that.
No, this just makes it sound as if you're working at a table doing some work that you might be able to do it without a mask. And I think other than eating, it probably is a good idea to keep masks on in the buildings, unless you're in a private office where you wouldn't expect anyone else to be coming in.
Okay, I mean, I think effectively we're talking about the same thing here. We really don't have space where an individual is working privately in an office that's not shared unless it's a private office, such as like mine.
I would just make that clear.
Okay, and I think Wendy had her hand up.
I did, but I'm trying to follow you. I didn't know if you went past it. Because I took notes on my agenda, and I was trying to see if you had passed where my note was earlier, but I think you went too fast for me. But I have page 5 listed on mine. There was a reference to employees will be trained. On the, let me see, and maybe we're not there yet.
I know that the Department of Labor and Industry standards that came out last week do require training for staff. We have 60 days in order to be able to put together some training that needs to be made available for all staff on safety precautions.
And that's, I have it, I thought it was in here somewhere. That's what I marked on. I'm trying to look 2 different places at once. I'm sorry. But my note was, and if it's not in here, we can, if you address it again, you could answer it. But my concern was when I read through it, when it said employees will be trained on just these interactions and procedures, that safety procedures. How are you going to do that? Is it going to be virtually like this?
Most likely it'll be virtual.
Okay, and that they will be required, everybody will be required, will there be some kind of acknowledgement that they have in fact
Done so.
participated and agree to it, so that they I'm just thinking from many things that I've done. When people will,
I believe that's one of the requirements of the guidelines at the Department of Labor and Industry.
okay.
And do you have videos or demonstrations for putting on and taking off gloves and masks?
We have links in this guideline here, a few bullet points down to the CDC's guidelines. I don't believe those are videos per se, but it's.
I don't think they show it. And I think it's really helpful for somebody to see. It's quick. Somebody could do this by a Zoom meeting just to do it properly. But it's a place that masking and gloving tends to fall apart.
Okay, well, I would think that during the training, that would be an appropriate time to
hopefully as soon as possible for the masks and gloves.
And I did have another question. And this is a little bit off of the safety, but back up to the staffing. Do you have a number or a baseline for how many employees cannot work at home?
how many employees cannot entirely work from home? We
All
only
right,
have,
both, I guess, yeah. I mean, because I was a little worried because of the stipulations for, how much they can, when they can work and when they can't, and if they can't, some of the positions of the work cannot be done virtually, and they have to come in, or it can be done. I just wondered how many of your employees that's a problem for or not, or how many we have that are.
we only currently have 2 employees that are working entirely virtually.
Okay.
Almost every position requires some form of physical presence in the building, and when we reopen, we're going to require even more kind of public service people in the building.
Okay, and you'll keep us updated if that becomes an issue or a problem.
In terms of not having enough staff?
Not having enough, or the staff not being able to, for the reasons that are then stipulated, other things they can do if they feel uncomfortable, if they have a condition where they can't wear a mask, or they can't, or they have an underlying condition, and no matter how well protected they are, they're not going to be comfortable. And the other side of the coin is if you're not going to have enough staff for the limited hours.
Yeah, I mean, we've already run into some issues, Wendy, where we have staff that aren't available to do certain types of work, or have medical reasons for being excused for not being able to do certain types of work. So this is certainly a strain on the cross-training program, which we don't have yet. But we are currently able to provide service. We can provide service through Tier 3. We'll get into what happens if somebody gets sick later as we scroll down here. But that's the main concern, is if we run into a situation where we have to quarantine, members of staff, then we are going to have problems maintaining service at that point.
Yeah, that was all of that was clear on the quarantining and all. I just wondered if there were some people who are going to be required to come now, and they're not. It's not COVID that's keeping them out, but another medical issue that they wouldn't feel comfortable. I just wondered if you were accommodating everybody virtually.
To the best of our abilities, and if it's not possible, if there's a job that has to be done, in person, and somebody has some sort of underlying medical issue, then we're working with the City of Charlottesville HR on those leaves mentioned above.
Right. Yeah, I saw those. I was just wondering how many people might be affected by that. That's okay. and how it would affect you all, because it's Charlottesville, so I don't know what control you really, numbers you had. Okay,
Well, it's available for all of our staff. City HR makes the final determination on
right.
if somebody qualifies for those. We have had a few individuals apply and receive that, so it's under 10, I believe, at this point. But
Okay, yeah, good. So,
other questions? Okay, the section on PPE also has not changed from the original Tier 3 guidelines. We tightened it up a little bit maybe to make sure that staff and public understood that masks have to cover both the nose and mouth, not just sit on your face. And we clarified a little bit about face shields here. Initially, there was some concern about helping patrons on the computer. And again, we'll talk about computer use in a bit here. Within 6 feet needs to include a face shield as well. Each staff member has one. We're strongly discouraging that. We have worked on some remote desktop possibilities so that staff can be at their desk and still work with the public on computers. There's a whole computer section where we'll get to the ins and outs of that. Six feet of social distancing required between all staff and the public. So there are corners in the buildings where people are going to pass, but staff has done a good job of minimizing that, trying to get directional indicators in place. We're moving quite a bit of furniture. I mean, at most libraries, there's maybe one chair available for everybody. So the goal is to have no interaction within 6 feet, period. Okay, and then there's a whole section about a self-assessment that staff need to go through when they enter a library building. So they need to affirm a clear health status before they come in. There's a list of symptoms here. We do have contactless, well, I'm sorry, not contactless thermometers. They're little thermometers that you point at your forehead, so they don't involve putting them in your mouth or your armpit or whatnot, but they do need to be wiped down after each use. So we have thermometers available for staff at each location.
Are you logging that, David?
No, we are not logging that. The self-assessment shall be done as a mindful process and will not be documented by any other means. This I took from Albemarle County's plans that they have in place here. There were some concerns about HIPAA violation if we're logging that information.
That's taking HIPAA a bit far.
So are you making a suggestion?
I am. I really think that at least having a record that a staff checks off that they have done this is going to be useful in terms of liability. You don't have to have the specifics noted, just as long as the staff is willing to initial it that they've done this, something like that.
And that was my concern about making sure, if you said they will be trained about all of these issues, so that would be accommodated if they sign something or agree to it, that then you would be holding them accountable for all of this, including, they're checking themselves. I was worried the same as Marcy, that they wouldn't, not that they wouldn't, but that you should have accountability.
I can see that point, and that makes sense to me to, in the training process, say that every day you're going to have to do these things. Marcy, would that meet your fears there?
I think even if people just initial, I have completed the self-assessment, and a date.
Okay, we can look into it.
And again, just being doc-like, thinking about liability issues, that's all.
Mm-hmm.
Yeah, and in terms of liability, I will say that we have had this vetted by both JMRL's attorney, our insurance company, and also the health department. So if that comes up.
The county is requiring a basically like a little checklist. So the county is requiring staff, even though you go through the temperature check. I guess it's not recording like in record of those, but then when the person clocks in, they're supposed to also verify that they did the self-assessment.
Okay, well, we can look at adding that.
Maybe like a daily survey? That's what UVA is planning, like an app check-in on the daily where you're like, yes, I don't have these things, or my temperature was fine, or whatever.
Yeah, that would be great. And
That sounds good.
I don't think that's a privacy issue, David, honestly. I think it's more the other way.
If you really were worried about the medical privacy, maybe it could just be a broad statement.
Well, that's what I was suggesting.
Well,
That,
but I was going to say not just a medical statement. So there's a list of, here's the things I need to be able, to be able to report for work today. I need the medical things, and also I have to have brought my pencil with me, or whatever, whatever the list of requirements is. But if the medical is just one section on a list of requirements, now you're affirming to all of those things and not specifically medical. I don't know if that would help from a.
Right. That's why I was saying everything in the training. Yes, I have taken the training, which consists of this.
Well, I think Marcy's point.
Yeah.
She would
Well,
like to-
I would. Oh, I'm sorry.
Yeah, I'm
But
sorry if we're getting a
Yeah.
little delay. I'm sorry. I think Marcy's point was she would rather have a day-by-day log rather than
Right.
a blanket.
Right.
Well, Marcy has made a point. Why not let David check with the attorney to see if it's getting into HIPAA? And if it is getting into HIPAA, then maybe the attorney can offer some suggestions. And we don't have to second guess.
I think it would be fine to see what the county is doing. I know they have tightened up some of their restrictions since the first view that I had of it. So if it's just a matter of having a checklist at each location that staff are responsible for signing, saying, I am here, I have performed my self-assessment, then that doesn't seem like a difficult thing to do. I think creating an app to do it, Erica, maybe a Survey Monkey or something like that, but I think it might be easier by paper at each location.
actually, hard copies they have their place.
Yeah. So yeah, I'm fine with taking this back to the Emergency Planning Committee and coming up with something here that meets those needs. Okay, and then what happens if staff cannot confirm a clear health status? They're eligible for paid administrative leave should they need to seek a COVID-19 test. We need to make a determination as to whether or not the employee is suspected to be infected with SARS-CoV-2 virus, which would engage the return to work protocols that we're going to get into. This is directly from the Department of Labor safety guidelines that came out last week. There was some confusion there that I'm hoping the state will clarify about whether or not someone is suspected to be infected with SARS-CoV-2 virus. But we're going to err on the side of caution here wherever we can. So basically it means, and we'll get into this in a bit, but if somebody has no alternate diagnosis but still has these symptoms, then we'll treat them that way. Questions? So also not much has changed. A few clarifications here based on feedback we got from staff about the plan for individuals who come into contact with COVID-19. I read something in the news the other day saying if you don't currently know somebody with COVID-19, chances are you will in the next few months.
I think that's really true.
Yeah. So after a positive test or close contact with someone who has tested positive for COVID-19, staff need to immediately notify their supervisor, who needs to immediately notify me. Positive test by a staff member or close contact with someone outside of work who has tested positive means a 14-day quarantine period for that staff member. In order to be eligible for extended leave options, the staff member must seek a medical diagnosis or the advice of a healthcare provider. So that is in order to engage the federal extended sick leave that's available. Staff may choose not to do so and use their own leave, but we will recommend it to all staff. The health department's guidance for close contact is within 6 feet for more than 15 minutes or in direct contact with secretions. I won't get into the details. Any staff in close contact with another staff member who's tested positive may also need to self-quarantine. So close contact in the workplace determinations will be made on a case-by-case basis between staff, the managers, and the library director, and mitigation steps may vary. Staff will be informed of the potential time and date of contact, but managers may not share medical information about any individual JMRL employees during this disclosure. So this is directly from our insurance company vis-a-vis HIPAA. basically. According to the DOLE guidelines, within 24 hours, staff need to be notified that they might have been exposed, but we are not allowed to announce who that was. I think that in most locations, it's going to be fairly obvious. You know, if we say to somebody, you were on the desk with somebody who has been exposed from 10 to 2 on Saturday, then they're going to know who it is. There's nothing that prevents the individual from letting their colleagues know, but the organization is only allowed to say, here was the exposure place, here was the exposure time, and notify within 24 hours of finding out every individual who potentially was exposed. Questions about that?
I know that this has been a sore point with people who work in high COVID infection locations, meat packing and that sort of thing, that they don't know, that they're worried if they haven't heard anything, that it's not because nothing has happened, but because they just haven't been told. So I think with our smaller staff and with the trust in the library, we ought to be okay there, but it has been a real issue of trust when people are not getting information. Just something to keep in mind, David, that's all.
Yeah, absolutely. And that's why I'm glad that the state, you know, went ahead and made this law, basically, so that that has to be followed. And the other side of this, which I'm not sure gets addressed, but that the library will make a public notice if it happens as well, to make sure that the members of the public who may have been in the building are aware that there was an exposure at that place in that time. I think that's equally as important to be transparent to the public about.
Absolutely, maybe even more.
Yeah. Okay, if close contact is determined in the workplace, staff members who had contact with a staff member who tested positive will need to seek a medical diagnosis or the advice of a healthcare provider. That's generally in order to make sure that they qualify for that extended leave. They don't have to use their own leave for that. Deep disinfectant cleaning will be scheduled for high-touch areas the employee who tested positive used. So I've been in contact with each jurisdiction about what this would mean there. We have actually seen this happen. We had a positive test case in the job center at the Central Library several weeks ago and engaged the city's protocols for targeted cleaning of the job center and any shared areas, including the restrooms on the lower level there. So every one of our jurisdictions is prepared to jump in, or the cleaning crews that they subcontract, most of them have subcontracted out specifically for this purpose as well. And then branch or department closures may be necessary if widespread close contact would leave the location without enough staff to provide service. So at our locations, we are attempting pod scheduling where it's this group works on Monday, the other group works on Tuesday, so that if there's an incident, one of the pods would still be available, but logistically that's proven to be very difficult. And even were that to happen, you know, we would not be able to provide the same range of service if only half the staff were available. I think in most locations, closure for close contact is going to be likely because of the size of our buildings. It would only be in the much larger buildings in a very isolated situation where it would be just a department, something similar to what happened at the job center. Okay, any staff in close contact with another staff member who themselves had close contact may continue to work. The health department considers those contact of a contact and calls them low risk. If any symptoms pop up, then we'll go back up into the earlier protocols. And the last section here is about return to work, and this comes directly, here's a link for those state standards that I've been talking about, the DOLI.
Mm-hmm.
An employee exhibiting any of the symptoms should not come into work. Employees may share their own health information with other staff, but managers will not share. This is what we said before. If they're suspected to be infected, they may return to work with one or more of the following conditions: a confirmed diagnosis of another illness, the flu, common cold, allergies. Staff did point out that this makes it sound like you can come to work if you have the flu. That's not the case. You know, if there are other illnesses that would normally prevent you from coming to work and keeping your colleagues safe, then you will, of course, stay at home for that. The other options are 10 days after the onset of symptoms and 3 days after symptoms end. And they define this as no fever without fever-reducing medication. So just no fever all by itself without treating it. And the last one is with 2 negative COVID tests taken 24 hours apart. And this seems unrealistic at this point due to the testing issues that we're having locally. I've had staff who have gotten tested and gotten their results within 48 to 72 hours, but I also had staff that got tested and didn't get results for 3 weeks or more. So it's much more likely that the return to work will be based on 10 days after the onset of symptoms and 3 days after symptoms end. If JMRL learns that a patron in the building during Tier 3 has tested positive, JMRL will attempt to identify areas requiring deep disinfectant cleaning. Staff and admin will work to determine if there was any close contact, and if so, a 14-day quarantine period would be necessary for staff. We'll contact the health department to assist in any contact tracing. It's more likely that we will hear this because they have contacted us to say we have done contact tracing on somebody and they were in the library on July 30th for these hours. Okay, so those are the nuts and bolts of how JMRL is going to handle contact with an exposure and exposure itself or illnesses. So this is a very important section here. These are the protocols that we are using currently as well, even though they're in the Tier 3 guidelines. These have been vetted by the health department and by our insurance company and by our lawyer, but I'm happy to take any questions about those because it's very important. Okay. All materials returned from the public will be quarantined for 72 hours. Delivery doesn't need to be quarantined because it was quarantined upon return. Same for materials from tech services. They've been there for more than 72 hours. This is where we would potentially address the point that Marcy's making about quarantine carts as well, if we're going to add something there.
Why materials from tech services don't need to be quarantined, David?
There are new materials that are coming in through the mail, basically. So like new materials from Baker and Taylor or whatnot, and there's more than a 3-day turnaround. In order
I see, okay.
So we've discussed this with tech services, and if there were a need to, we could certainly implement that there as well. Delivery continues to be an issue right now. We had, and the library board's well aware when we talked about delivery, you had a continuing ed on it earlier this last fiscal year, and we have one full-time employee and one part-time employee doing this delivery, which is really a 7-day job. So the part-time employee left for another opportunity. The full-time employee is on extended leave. So it's been a bit cobbled together recently. We've got 3 staff members that were trained and have been working this, but it's not all branches every day. So right now it's 3 trips to Crozet, Gordon, Bookmobile, and Northside, all in one building there, starting at Central. So those are 3 times a week, and then twice a week to the outlying branches. One of the positions, the part-time position, closed on Friday, so we're hoping to get some good candidates there and get somebody in. All meetings and committee work remain virtual unless prior approval is given by the library director, but pretty much they're virtual. There is an enhanced cleaning doc that I hope you all had a chance to see. Let's see if that worked. This also changed quite a bit between the earlier version of Tier 3, which was 50% capacity, and the current discussion about appointment basis. So it's just changed basically to have the work done every 15 minutes after appointments. So areas touched and used by the patrons must be sanitized, and there's a list here. At the end of each shift or in trading off any materials that would be shared, phones, keyboard, mice, things like that. And then just kind of the high touch areas in general, door handles, things like that. And again, much thanks to the Emergency Planning Committee for all the work that they've done on all these documents. So that's available for you all to see. Water fountains are all out of service except for the bottle filler, which I believe is, we only have one. I can't remember where it is right now. The restrooms, we're not going to be able to clean throughout the day. Signage is posted basically saying, we'll do that, the doors and things like that, but we just don't have capacity to basically clean it after every set of appointments. So the signage basically says, be aware this is only sanitized nightly. It's, we'll clean, we'll do some spot cleaning, but it's not going to be the cleanest place in the world till the night. Break room guidelines. This also is laid out in the Doley requirements that you have to have signage posted on what capacity is. Like at the central library here, the branch manager, Christopher, will remove most of the furniture and a signage will be posted saying only so many people in the area at a time. It is important. We've been talking a lot about the need for breaks, especially with the 100-degree heat and staff having to come in and out of the building in order to provide curbside service at most locations. Wearing masks and providing service in 100 degrees is brutal. And we need to be careful to make sure that we're allowing staff to hydrate and to rest as needed. Alternate break spaces if available. So if a branch has meeting room space that's not going to be available to the public, it should be made available for staff to use for cool down. Staff should clean up after themselves according to enhanced cleaning guidelines. As we mentioned before, public service staff should be aware of the location of other staff and the public in the building at all times. So we know what service areas the public used in order to apply the enhanced cleaning and also to avoid unintentional close contact. Okay. Making appointments. Scripts and checklists will be available for staff making appointments to the public. The important things are letting them know that you must wear a mask when you're in the building, and that if you're exhibiting any of the symptoms we mentioned below, please try come back when you're not, basically. And then letting them know that it's a 45-minute window, that if they're late, they don't get 45 minutes from that time. At quarter till, they're going to have to leave the building. The computer sessions will be ended. We're only making appointments for each branch staff will only make appointments for their location. They won't be making appointments for other locations so that they can ensure that if there's any specific information about that branch's service, they can impart that. You can make them for 7 days in advance. Each patron may request 1 appointment per day. So to begin with, there'll be no limit to appointments per 7 days except for the 1 per day mentioned above. There's been a lot of discussion about this, and my opinion is if we're going to move forward with this plan, we should see what the demand is and see if there is abuse where somebody is logging an appointment every day that's keeping other people from using it, then we might have to revisit this. Appointments are on the hour and only 45 minutes. Appointments will be made using the library's meeting room booking system. Each person will require an appointment slot. Walk-ins will be allowed if there is an available appointment slot. If someone was scheduled but did not show, that slot is not available for a walk-in. So this is to avoid confrontation for staff who are trying to manage entry and exits from the building. Walk-in appointments will also need to agree to the items on the script mentioned above and must be aware that sessions will end at quarter to the hour, so they don't get more time. They don't get 45 full minutes. If a person fails to show for their appointment, that slot will remain empty for the duration of the appointment window. If a person shows up late for their appointment, they will be admitted for the remainder of the time left in their appointment. So they show up at 10:30 for a 10 a.m. appointment, they get 15 minutes. So again, the goal here is a trial period to see how this works, to see what the issues are and what needs to be tweaked for at least 2 weeks. But these are the guidelines that the Emergency Planning Committee has been working on and have shared with staff and JMRL managers. Any questions about making appointments or length of appointments, number of appointments, any of those types of things?
I think you're just going to have to see how that works.
And just for clarification, David, if a parent brings 3 children, that's 4 of the 5 slots then.
That's correct. That's the current plan.
Okay.
I've gotten some questions about that, Jim. Folks really would like for families to be accommodated.
Right.
And in my thinking, we're going to have enough slots available throughout the week that we can find a time to accommodate that family. And if not, then we'll have to revisit this after 2 weeks to see about expanding either the hours or depending on the location, more appointment slots. I do think that it is important that it's 1 per person, because otherwise, if we say a family unit, I had this discussion the other day, if we say a family unit can make 1 appointment, then you run the risk of the 5 appointments being 5 families with 25 people and butting up against what the local restrictions are going to be.
Understood.
Okay. Information for the public. So the first thing is about hours. JMRL is seeking to add Monday evening hours, regardless of whether the board decides to move into Tier 3 or remain at Tier 4. 3 to 7 initially, and then the same hours that we currently have for curbside and drive up for Tier 3, and then revisiting those at the end of the trial period. I think if the board were to decide not to move forward with Tier 3, then we should also look at extending some hours here at certain locations. We've gotten a lot of patron feedback about hours at Northside not being sufficient to meet demands. So that's something that definitely we would like to consider regardless of whether we move to in-building appointment service or not.
I'm a little surprised that you haven't expanded at North Side, the Tuesday
Yeah.
through Saturday times already, because they have been.
Slammed.
Yes.
Yes. Well, the goal has been to do that, and the thinking was we were moving to tier 3 in the beginning of the month and we would start to add hours at that point. But since the delays, we have tried to keep things uniform. It's very hard to control messaging about what services are available when there's so many changes. But I'm willing to relinquish control of that as we move forward into tier 3 and have branches tailor themselves to what their needs are, like their normal schedules are. They're not consistent now.
Exactly.
Yeah.
So I wanted to say first and then ask a question. I do think that even if we had the same limited number of hours, it's very important to have a range of different times. So adding that evening provides access to people who just, aren't available 10 to 2. So I'm definitely very glad to see that added at least one day and, hopefully more soon. My question overall is, how do you determine when we're going to be able to expand the hours? I mean, and sort of where are the bottlenecks right now? Is it just, I know that staff, first of all, there's a lot of overhead just in changing all the processes and protocols. But I know there's a lot of new demand just pulling these thousands of books from the shelves. Where are the bottlenecks and how will you, I guess, how can we get to a point where we have, more hours, which is what fundamentally I think what people want, whether it's curbside or in person. What are those bottlenecks and what are those decision criteria that you're?
Mostly they have to do with staff and being able to safely place staff in the building with social distancing requirements. So opening more hours means more staff in at the same time. And throughout tier 4, we've been able to stagger those schedules at the larger locations where there's demand for more hours in order to have limited staffing, basically skeleton crew type things in shifts so that they're not in close contact with each other. Beginning now, basically, we're ramping that up so that there is more staff in each building in preparation for an in-building move. I believe that that's the biggest bottleneck, Mike, is just having the staffing there in order to meet the demands. When we were first talking about tier 3, not appointment, there was real trepidation about opening up more hours because of the increase that my expectation and what I've seen around the state is that there will not be a cessation in demand for the contactless, that will continue basically at the same usage rate that we have now. We'll find that out, but my assumption is that the same number of people are going to want to be able to do this without coming in the building. But adding into that, now we're going to have people in the building. Before we had the appointment scheduling, and the idea was at 50% capacity, we were talking about having to divide staff up to meet both those needs. Like if you take Northside, for example, you need the same amount of people to do traffic control, to man the phones, to do the window, to be the runner to the window. And then in addition to that, you would need the more staff in order to provide children's services and help people on the computers and check things out. With the appointment scheduling, I think that we have a lot more flexibility to be able to add more hours if we were to move into tier 3. And if we're going to stay in tier 4, I think we could make those moves pretty quickly.
So I guess I'm just wondering, in the back of my mind, longer term, do we just need to staff up and hire more and make that case to the jurisdictions and so forth, or is that not the type of bottleneck that you're talking about right now?
I think it depends on the, we couldn't hire throughout the end of the last fiscal year. So we had a bottleneck of positions that weren't moving. So we were understaffed in quite a few locations. Those are now moving as of July 1st. So we have positions that are available. The city was really great in partnership by allowing us to hire some key positions, such as the new IT supervisor who came on at the end of the fiscal year. But in general, we were waiting. So now we're getting back to our full capacity. I don't know that the jurisdictions, we'd have to speak to them about adding more positions at this point. They clearly haven't budgeted for them for this fiscal year. And in fact, most of them are doing quite a bit of belt tightening now and freezing some of their own positions. So that would be a difficult sell potentially. I think once we have most of our staff up and running close to their full schedules, we have capacity, especially with an appointment only system where you can kind of pick and choose who you need where.
Okay, thanks.
David, might this be a good time to do a staff study? Like, we are seeing increased demand. We expect it to continue indefinitely. We would need X number of new employees to handle that properly. And then you would have that data to take to the jurisdictions to say, this is what we're seeing, and
Sure.
numbers.
I think that we'd have to be at our full hours for each jurisdiction also before we would make that ask. That's my gut feeling there. That, you know, the response would be, well, you're not,
Right.
this is less than we had pre-COVID. You know, once we're back up to full hours at each location, then it makes sense to me to be able to say, look, we're being torn in several different directions here with new service models that we require new staff for.
Yeah, but just to collect it.
Yeah,
maybe
to collect the
there'd be a
data,
good start.
sure. Sure, yeah, let me make a note. Okay, the next bullet point is about the appointments, basically for the public. It's 5 people for 45 minutes, 15 minutes for cleaning, 1 appointment per day. Scottsville can only have 1 appointment per hour. Gordon Avenue can only accommodate 3 appointments per hour because of the size. Bookmobile will not be in service during Tier 3. So just a clarification on this, the Bookmobile itself is not going out because it is designed for on-bus use, and you cannot socially distance in that scenario. Marion and her 1 staff member, though, are providing service to the in-home care facilities that are accepting it right now in a contactless manner. So quite a few of the assisted living facilities that were serviced with the Bookmobile schedule are still getting that service, but it's a drop-off pickup, and it doesn't involve the Bookmobile going out there. It involves bringing materials and picking up what they have for return. So the statement here that the Bookmobile will not be in service means that the stops as listed on the schedule are not being met. Some service is still being provided for folks that have that capacity right now. Any questions about those limitations at Scottsville, Gordon Avenue, or the Bookmobile? Okay. All branches will continue to offer curbside and drive-up service during Tier 3. So patrons must agree to the following before admittance to the appointment. Masks are to be worn covering the mouth and nose at all times in the library. Patron doesn't have any of the same list of symptoms. Patron is not tested positive for COVID-19 within the past 14 days. Patron will maintain 6 feet of social distance between any person they encounter in the library. Patron understands that at 15 minutes before the top of their hour, their appointment is over and they must exit the library building regardless of whether or not their library business has been completed. Which sounds harsh, but it's not an easy task every night in pre-COVID times for staff to clear a building, especially a larger building where people are out in nooks and crannies, hence also the comment earlier about knowing where people are in the building. Are there any questions about the requirements that JMRL is going to have of the public before allowing them admittance?
How are you going to document this?
Document that. Right. Same question.
In the meeting room booking system, basically, we're only going to make appointments if somebody agrees to these things, and then they'll have to agree again verbally at the entrance.
Just verbally, then?
Yes, that was the plan, although I'm open to feedback on that.
Is there a way for them to have to agree to this on the booking system?
The booking system is not actually an online, they fill out a form. We looked at a few options for that, and in the end decided that it would not be equitable, especially for the folks that need computer access. They're trying to get access to the library in order to use a computer, and telling them they need to use a computer in order to sign up for that didn't seem fair. So it's a phone or email conversation with an individual staff member. So they're going to talk to a person.
Okay.
And agree to these things.
So there will be a log then of the appointment.
Yeah, and also I got a recommendation from Mike, which I thought was a very good one, to keep a log at each location of appointments that we had to turn away.
Yes.
We had 5 full, so we know what actual demand was, not just what we were able to meet, but what we couldn't meet.
Absolutely. Well, you ought to be able to just have them check a box then that they have gone over these requirements with.
Yes. Staff will have a checklist that they need to go through.
Fine.
When making appointments. No public meeting use at this time. I'm sorry, meeting room use. And the reality of that is that, you know, one, only 5 people in at a time to begin with, but 2, most of the public meeting rooms are full of furniture right now. They're not really available. This is a frequent question. The 2 most frequent questions that I've gotten this summer are about book donations and meeting room use. But unfortunately, we don't have the capacity for that now. No physical library programming. Still plenty of virtual library programming. Kudos to all of our programming staff for that. That has been a quick pivot and something that has been remarkably well attended. Another thing that requires time of staff that's difficult to do when they need to socially distance and can't necessarily work together physically on these. So that requires time in which they're not doing public service. And at this point, any open hour means pretty much all hands on deck that are there for public service. No food or drink allowed. Assistant Library Director Krista Farrell says we're moving backwards in a lot of our policies here, and that's one of them. The external book drop is still the best way for folks to return materials. Face coverings and masks will be required for those entering the library by state mandate. Children under the age of 2 will not be required to wear a mask by CDC recommendations. We still have free masks from the Department of Health. Out of the 6,000 that they gave JMRL to distribute, we have about 1,000 left, but also Jerry has been acquiring them since we entered our COVID plan. Patrons will not be allowed entry if they don't comply, and they will agree to wear the face mask when making appointments. Otherwise, only contactless curbside drive-up service will be available. There are some ADA concerns here. So there might be instances where someone will need a reasonable accommodation for this, and they will have to make those arrangements with me, and I could help provide service either in a contactless fashion or at hours at which nobody else is at the location. So we'll run this by the lawyer, but basically no mask, no service, as the governor said, no shoes, no shirts, no masks, no service. And the difference between this tier 3 guideline and the original is that we will not allow entry if someone refuses to wear a mask. Questions about that? I know this has been a big topic of conversation around the country, so now's the time to discuss if there are issues. Okay, again, social distancing is required for the public. Most furniture has been removed. In-building library service by appointment, and most of our locations that have the space have moved to self-pickup and checkout of holds materials. So for instance, at the Central Library where the holds were formerly behind the circulation desk, now they are out in shelves for when the public comes in. You'll be able to grab your own, go right to the self-check and take it out if you like. Again, for the public restrooms will be available with signage indicating they're maintained but not on a frequent cleaning and sanitizing schedule. Use at your own risk. That wording came from the City of Charlottesville's Facility Maintenance Department. Okay, computer access. Computers will be available by appointment for essential use only. Checking email, printing documents, filing for unemployment and other benefits. Staff had a lot of questions about this, asking who's going to be the judge of essential. And the bottom line is that no staff is to be making that judgment. These days, people can be applying for jobs on Facebook, and we're not gonna stop anybody from whatever their usage of the machines is. We're just encouraging here the public to think about what their needs are and to limit access if it's for non-essential access. But if they come in and sign up for an appointment, then nobody is going to be looking over their shoulder to see what they're doing. Of course, protecting their privacy. Staff will not be able to provide any close contact computer support, meaning within 6 feet. Face shields are available for staff giving computer support from more than 6 feet away. We're also probably going to have to, one of the managers joked this morning that she would need to bring her progressive lenses in order to do that. Printing is self-service. Staff are authorized to add manual charges to cards in lieu of cash transactions. This is more of a behind-the-scenes thing for staff, but that's something that we'd never allowed before, but we will allow them to add costs onto their account that can be paid by a credit card rather than needing to take cash. We're trying to limit any cash interactions at all.
This is actually critically important because of the coin shortage right now.
Oh, that's a great point. Yeah. Assistance from staff will be limited to 10 minutes or less, maintaining social distancing. Library materials will check out for their regular loan period. Holds will expire on their normal schedule on tier 3. So this already happened. Right now, when you check something out, it's for 3 weeks and the whole period is for 7 days. Okay. No late fines will accumulate during tier 3 for return materials. And again, the idea here is to limit cash transactions. Patrons should be strongly encouraged to make use of online payment forms if they have previous fines to take care of. Cash handling should be very limited. While making changes permitted for printing and copying, staff may do the following to limit contact. Add those manual charges, as I mentioned, to patron accounts, or override blocked accounts when patrons try to pay with cash, asking them to pay with debit or credit using the website, or mailing a check or waiting until tier 2. And then just a note for staff and the public, when we're having these transactions, it needs to be 6 feet apart. Any questions about that? I did get a comment from a former board member who had concerns about this causing a delay in materials without the fines there. We have not had fines throughout the COVID-19 response. Jerry and I have talked about the financial implications there. I'd be happy to come up with a report on that for you all. But in terms of the cash handling, it has been basically down to 0 at this point. Any concerns about that?
Not a concern, but I'll just point out, I know it is on our 5-year plan for the future to evaluate making a permanent change. This seems to me to be an opportunity to collect data in terms of both the financial, but I think that one of the comments I heard from the member of the public was just that overdue materials wouldn't be returned. There's no incentive then to return those quickly so that things don't move. So that seems to me to be the type of thing we could collect some data about. And that just puts us in a better position for decision making when we do that 5-year plan evaluation.
Thanks, Mike. I agree.
And it makes me curious, is there any data yet on how many books and materials being returned late because there is no fine? Has that been an issue so far, David?
Well, nothing was due until the end of and I'm going to mangle this, but I think it was the end of June. I can't remember the exact date. So things that had been checked out basically from the beginning of March had no due date, or they did, but it kept being extended basically because the safer at home guidelines were saying, don't leave your house. So after that, things began to come back in waves. I do know that we triggered a milestone today where items were 30 days overdue, I believe, from the date of the first due date. And that triggers a bill that gets sent. And I think there were 1,800 of those. So 1,800 things that didn't get returned by the extended due date. But that doesn't answer your question about, the things that were 2 days late or 3 days late. We also have had items quarantined for 72 hours. So they were technically, everything was late because it doesn't get checked in until 3 days afterwards.
Correct. I could see maybe more data as we progress through this.
Yes. The dollar fees for replacement cards was actually one of the last pre-COVID actions that this board made. So that was just letting the public know that you removed that from the fines and fees schedule. Some information here about how the 1,000 folks that have made virtual cards, if they were to come in to use the library, they would be able to. It's a little bit of information for staff about what that's going to look like and what they need to do. Okay, we're getting towards the end here. The following things are not available in Tier 3. Notarization, we just couldn't see a way. This is maybe the 3rd most common request. Actually, the 3rd is probably faxes. This is maybe the 4th most common request. Where can I go to get something notarized? With the staff being pulled between curbside and appointment service, it requires a notary to be on hand, which it always does, of course. But it's very difficult to do without some sort of close contact. So at least to begin Tier 3, this is off the table. Same for meeting rooms. Donation drop-offs at branches. Now this might change as the Friends are evolving their own plans here. Initially, for the original Tier 3 plan, Gordon Avenue was going to be open in the basement for donations during curbside, during hours of Tier 3. They're still working on that though. That's not official yet. So my hope is that at some point during Tier 3, we'll be able to at least have Gordon Avenue open for people to make donations. But normally we accept them at all locations and they need to be carted around by the delivery, and we just don't have the capacity for that right now. Computers in children's or teen areas are not going to be available. Library volunteers will not be coming in during Tier 3. The 3D printing service is on hold. This says office supplies like pens, pencils, scissors, tape, and staplers, just because of the shared nature of contact there. Although at each location, we've made a small amount of supplies available just to give away. We've got handouts that are pens or pencils with JMRL on them that we can just, if people need a pen to do something, they can keep it at that point. So the tactile materials in our children's rooms, like toys, games, puzzles, puppets, will not be available. Unfortunately, this one's a heartbreaker. The toy library is not available. If you recall from your continuing ed, those of you who saw it, those were cleaned individually by volunteers at the Madison House at the university. So somebody checked it out, and when it came back in, it got cleaned by the Madison House, and that service is not available currently. Health literacy and maker kits are not available because they can't be returned through the exterior book drops. They're too large. The Discovery Museum passes are not available because the Discovery Museum is not open at this time. Proctoring is not available just because of the lack of staff capacity to meet those needs. Oh, the donations is doubled up, so I'll get that fixed. Currently not being accepted at any locations, and we'll wait on the Friends decision there. So here's a limitation on some things. Displays are at the discretion of the branch manager. Basically, displays might not be available. This is both for exterior use and for interior use. It kind of depends on capacity at each location. There's a little bit of discretion for the branch manager there. ILL service is available, but expect major delays. Most of that is not on our end. I think it would be pretty quick on JMRL's end. It's our lending institutions and also the Postal Service. Book club kits are still available, although they're the same limitations in terms of, for years we were able to tell people 24 to 48 hours, your hold will be here. Well, now because of quarantining items and because of the limited delivery, it's more like within a week we strive to get your materials there. We're going to circulate the state park passes that came with the state park backpacks, but not the backpacks themselves. So this is free entry to Virginia State Parks. Again, because the backpacks can't be returned and they have lots of little items that would need to be cleaned. Wi-Fi hotspots are still available. Summer reading prizes are going to be available should we move to Tier 3 in order for folks to come in and pick up their prizes for having completed the summer reading challenge. Okay, that was a lot. That was the actual plan, the Tier 3 restricted express service for appointment only that the Emergency Planning Committee has been working on. So around the state, most of our peer libraries are offering in-building service at this point, but not all. Some of those that are not are doing so because they don't have staffing capacity. Like staff have asked about Roanoke County, which is a peer library of ours in a similar data-wise for COVID-19, a similar situation. They had to lay off over 40 part-time employees, so they don't have capacity, but also they're being very cautious. A few are curbside only still. Richmond Public, which we've been looking at quite closely, opened up to the public in the beginning of July, but just last week shut down to offer only curbside service. So there has been no real guidance from the state on decision-making for any public libraries. It's mostly been consultation with local jurisdictions and with health department officials. So what I'm interested in is discussion from the board on this plan. I've got a few suggestions there that we'll incorporate, including a checklist for staff doing their self-check when they come in, adding a quarantine cart, making gloves available for the public, and then some clarification about, other than eating, basically masks being on. I'm also interested in a discussion about timing for this. The Emergency Planning Committee, basically staff are ready to go. We need a little bit of time to prepare. So if the board were to choose a date and say, a week from Monday, August 10th, assuming that percent positivity is going to fluctuate between 5 and 8% for a while, I've been hesitant to tie a move into in-building service directly to that because it's likely going to be fluctuating for months, if not longer. And so I would hesitate to say, one thing I've heard is below 5% for 14 days. Well, what happens on the 15th day if you open and then it's 6%? The original policy that we're using ties decisions to individual jurisdictions, so that's an option. We could also talk about tying to Albemarle County, which is still as the only jurisdiction that is not open at all at this point and is making plans to do so, or some other data point that the Emergency Planning Committee hasn't discussed yet at this point. So Marcy, I believe that's what I have to share there. Do you want me to stop screen sharing?
Yes, there are a few questions, David, if you wouldn't mind taking a look at them, see if any of those are needing to be brought up before we talk about dates.
Questions from the attendees?
Q&A.
Okay, if you're willing to take them now, then Sarah, can you check in on that?
Sure thing. Marcy, I'm not seeing any of the Q&A ones. Let me dig around here.
So I see a few comments from Wendy and then from Julia Moore about computer jobs, which may or may not be something that we should answer during the meeting.
When, Marcia, do you want to go ahead and read those out?
Yeah. One of Wendy's questions was already answered, but one of them was testing results can take up to 5 days. How will this be handled if a fellow staffer has symptoms? And it's actually longer than 5 days. David brushed on that.
Yes. So with the return to work guidelines that are listed there, Wendy, you know, the test itself, if the person is symptomatic, the test itself is not going to be enough. It would require 2 within 24 hours. So basically at that point, it would be the 10 days without symptoms and 10 days since the beginning of symptoms and 3 days since they exhibited any symptoms, and especially the fever without fever reducing medication.
And then there's another concern about what happens if you're doing a job application, for example, and you can't finish in 45 minutes.
Well, that's come up quite a bit from staff. And it's one of the things that I think would lead to reconsidering some of the timing as we get some experience if we move into tier 3. So after 2 weeks, kind of seeing how long those things take, if there's the capacity to save, which I'm not sure about, just I have not filled one out. But I do know that in general, they do take more than 45 minutes is what I've heard, especially if people are coming in with limited experience filling out online forms.
Yes.
So I appreciate that staff are very interested in being able to help people meet those. And so am I, but we'll need to do it safely. And I think it's better to kind of prove that we can do this safely, keeping the staff and the patrons safe, and then look at adjusting to meet specific needs.
Okay. Does anybody have any comments on David's query about whether the board should weigh in on when this opening should occur, if this should occur?
Right as we are having the meeting, the city of Charlottesville is also having a meeting about reopening.
Yeah.
And I'm very interested to see what they're going to say. I realize that we're preparing tier 3 for when tier 3 happens, but I'm also really concerned about what their meeting is going to tell us. And I realize we're only one jurisdiction, but this stuff to me is very serious, and I'm still apprehensive about opening anything.
Can I comment on that, Kathy? The Albemarle County is also meeting this afternoon to have a similar discussion. So my assumption is that those two have been discussing what Albemarle County proposed last week, which was basically some tightening of some restrictions in the area. And it included removing the limit on public gatherings from the current 250 in the state's phase 3 back down to 50, and also requiring face masks in all
Public places.
Public places. Yeah, thank you, Jim. So I don't know that for a fact, but I'm guessing that those are the two big linchpins that the city and the county are gonna do. But of course, if they pass something that would preclude the appointment scheduling that just got discussed, then we would have to revisit. As I said, this really would be in line with phase 2 of the governor. Even if the governor were to move the state back to phase 2, an appointment service with only 5 people in the building at a time would still meet those restrictions by far. So I hear you though, Kathy, about apprehension. There's certainly, you know, this is a new thing, and we're asking our staff especially to open up the doors to unknown situations.
And I agree again with Kathy about the seriousness of it. And I'm wondering, because looking at it at the region, Charlottesville, Albemarle are much different. And I guess the lowest case occurrences are actually in Nelson, I think, right at this point. But that, so we are going to do whatever we do together, and that's going to have to take into account Charlottesville and Albemarle seem to be the fastest growth of the virus, and we're all interconnected. Both obviously the library, but as a community moving back and forth. So there's no direction in Louisa, as far as I can see, from the county government standpoint. We're still waiting on the schools. They're still waiting on what's going on. So,
And actually, both Louisa and Greene are increasing the number of cases in a noticeable way, plus increasing hospitalizations. And I think that's the concerning part. It's the hospitalizations, meaning the seriousness of the process that's going on in the communities. You know, back in March, April, and May, we wouldn't have even known about a lot of those infections because the testing just wasn't available unless you had symptoms that prompted a physician to order your test. So, you know, it's really hard to compare what was going on then with what's going on now. But the hospitalization rate is something that I think you can keep an eye on.
I will say, you know, it is possible to stick with our current policy and actually implement it for the first time during this response and tie things in with the local jurisdictions, county office buildings. Currently, Louisa, Greene, and Nelson, I believe, are open and accepting members of the public. Charlottesville is by appointment only, and Albemarle is not open to the public at this point. So just for your information.
but when I went to the county office building, it's not open. I mean, they're very protected. There's no movement. You're going in, everything is closed off. There's no way for you to actually enter any space other than that foyer and somebody behind a plexiglass partition. The person can come down to you and speak or hand you whatever you need. So it looks like a space zone or asbestos.
Sounds like curbside delivery.
Yes, exactly. Government by the curb, maybe. But yeah, so all this, and yet the school is expected to go there. The board meetings are virtual. So yeah, I don't know. I think they've done a tremendous job of figuring every conceivable protection, and it makes perfect sense, but it's still.
Well, I think it's going to be an anxiety-provoking time.
Yeah.
This is not going to be over
Right.
by the end of this calendar year by any stretch of the imagination. So, David, can we regroup about this once we get feedback from both Albemarle and Charlottesville and their meetings today? Is that something that's possible for us to do?
As in hold a special meeting?
Yes.
Certainly, yeah.
How does that sound to the rest of the trustees?
I think it seems reasonable.
I think it's very reasonable.
Do you want to vote on that, David, or will you take that advice?
Well, you know, I think the only thing we would need is the appropriate public notification time, which is 3 days.
Oh, right. Okay.
So you couldn't meet again to vote on anything before the end of the week. But Marcy, as far as I'm concerned, it's your agenda and your decision about calling meetings.
Marcy, it seems to me there's two separate but related questions. One is, what are the parameters of tier 3, which is, what David just went through in length. And then the
Yes.
second is the timing, which is what we've just sort of moved to. I don't know if one of those can be finalized today, or if we are having a special meeting, I suppose that allows David the
Oh, that,
opportunity to put
yeah.
in some of the fixes that
I guess I was trying to deal with one question at a time.
Yeah.
Yes, well, can we do that? Can we deal with one question at a time? Can we deal with the timing first? And I would propose that we have another meeting.
Yeah, I was thinking more of the opposite, is that the timing is what we would wait for some guidance from the
Well,
jurisdiction.
that's what I mean. Wait, have another meeting once it's determined what the guidance from the counties will be.
Yeah, I think that's what I mean. But to me, I feel like that speaks more to the timing than
Yes.
to the parameters.
yeah,
I was just trying to get that out of the way because I think there's more consensus on that.
Sure. Okay, I see. I get it.
Oh,
Okay.
we're talking about time.
yes.
Yes.
And now I think the other thing that Michael was talking about was
Mhm.
the specifics in the
The plan.
plans, actually, one for the public and one for the staff. David, what kind of advice and consent do you want on those things? We've had a fairly active discussion about a few of the points.
I think ideally what I would look for is for the board to vote to accept this plan for tier 3, that this is the tier 3 model that JMRL is going to use with the changes that were suggested today.
Can we specify what those changes are?
Yes, the changes were to add a checklist for staff as they do their wellness check on entry to the building, to add quarantine carts for browsing at each location, make gloves available for the public while they're browsing, specify that masks need to be worn other than for eating, and then some of the other things were more about the training, like the videos being available for how to properly doff and don gloves and masks.
I would just add to that I think hand sanitizer should be available right as people enter, and I think people should be asked to use the hand sanitizer as they enter the building.
Okay.
Question about eating. That's only for staff and not for visitors. Okay,
Correct. Yeah.
that
Thank
probably
you.
needs to be interjected.
Yeah.
Yeah.
Thank you.
And David, this, how my mind works slowly anyway, but there was something, and I don't want to go back too far, but something about they could claim their summer prizes by going to the library. Does that require an appointment, or how does that affect the appointment and the scheduling as such?
Well, the first round of prizes have been available throughout curbside and drive up. They were little tchotchkes that basically the families could get as they come pick up their books. The second round requires a choice. It's a book basically. So the idea was that they would make an appointment to come in for whatever their normal library business was. And
So that would be one of the 5 people that time period. Okay, just something stuck in my head and I was trying to remember. Okay.
Do I have a motion about accepting these plans with the stated modifications?
So move.
We got it.
Thank you. I'll do a roll call. Michael Powers,
Yes.
Kathy Johnson,
Yes,
Harris. Sorry, Kathy.
that's okay. That's fine.
Your name got cut off.
No,
Jim
that's-
West,
Yes.
Carla Mullen,
Yes.
Erica Younglove,
Yes.
and Wendy Craig.
Yes.
And I'll vote yes as well. Thank you very much. I hope that gives you what you need, David, to move forward. And I guess we can,
So the goal is to have a meeting to discuss timing
timing.
and the information that
Very brief targeted meeting.
the information that you're looking for is what's going to come out of the city of Charlottesville and Albemarle counties joint, or not joint, but separate restrictions being announced today.
I believe so. And if there's a conflict between the two of them, as there may be, then I guess we need to deal with that as the library board.
And when, can you give me a sense of when you'd like this meeting to be?
Could we do it on Friday? Is that something possible for those of you who are here?
I could do Friday.
3 o'clock.
Oh, okay, regular board meeting time then.
Okay.
All right, we'll plan on doing that, David. Will that be helpful?
Yes.
Okay, good.
Hey, this is Carla. I think this has been said already, but based on what we're doing at the visitor center, even if the county and the city go back to phase 2, it's really not affecting, these by appointment or even limited hour type, interactions. And so I actually feel like we could set a time now to put the plan in place, right? The phase 3 plan into place, with the caveat, if there's some sort of news that comes out of these 2 larger localities, that then we might need to meet. I don't think what they're going to say is going to affect this plan all that much.
Can I get some feedback from other board members about that?
When you say affecting the plan, you mean affecting the time. I mean, this plan, we're just talking about waiting to see about the time for implementation. Whenever we do it, whatever time we pick, we've just decided the plan is solid. It's right. So.
Okay, well, let's say we want this in place by August 5th, and the county says August 5th, we're going back to phase 2, right? That doesn't change our plan at all.
Right.
They said we're going to phase 1 or we're doing a complete shutdown. Is that right?
You're right on that. That makes sense. Because
Maybe I'm confused, but I thought we had agreed, the majority had agreed to have a second meeting after this occurred, but that the tier that was just discussed would be it, with the changes, it would be okay.
I think that's what we did agree, Kathy. The question was the timing. That was the second piece of this. And I guess what Carla's proposing is that it really shouldn't make very much difference to us what's decided in Charlottesville and Albemarle today. Am I paraphrasing correctly, Carla?
Sorry. Unless it is dramatically different, than what they've been discussing in public. It really won't affect our timing. So, like, are you guys thinking that we wouldn't implement this plan until October? Like, I'm thinking that we would implement this plan sometime in August.
Yes, I think that's the hope.
oh, yeah, that was the hope.
So personally, I don't feel qualified or informed enough to for myself say that August 1st is the right date or August 15th is the right date. I'd like to tie it rather to some criteria that has been decided by an entity that has a much better public health information than I do personally. I'd rather leave it to find an expert, find the appropriate expert, tie it to their decisions in some meaningful way, and then just work on that as it's from a conceptual level or a criteria-based level, rather than us just picking a date. So to me, if it were me, I would suggest that each jurisdiction the branches in each jurisdiction could follow along with take the lead, let's say, just generally speaking, of those jurisdictions. And I think that one justification for that, look, there are real risks here, and we're discussing those and we're taking those seriously. But there's also there are benefits on the other side. All of us are here because we believe libraries are very important and important to the community. And even in an individual way, I think individual members of our community suffer when they don't have access to these services. So we're at the you know, at some point a balance has to be struck between those two sides of that equation. And it may be that, hey, the right answer is let's pick that balance way on the side of safety. That's you know, would be a credible criteria, but there's still a balance on the other side. And I guess what I'm getting at in a long-winded way is, in some sense, the jurisdictions reflect the sensibilities of their overall communities. I mean, literally they're elected to be representatives of the community. So I think if we're trying to pick, hey, what's the right balance, we can, for a given jurisdiction, I think that we sort of justify from that standpoint as the jurisdiction being a representative of their community, we could justify following along with those decisions that are being made. So to me, that's, Carla, that would be the point of just getting that final, you know, if we're deciding today versus deciding Friday, I take the point that we'll have a little bit more of a cue from the jurisdictions once they sort of come to their decisions today, if that's what's happening. But that's my thinking about it.
Yeah, so I think one of the things that we're talking, that we're confused about, or like, which we don't really have a good sense of, is, well, okay, what exactly are these jurisdictions saying? So, you know, they might be in their phase 3, and we're, you know, whatever that means. But in terms of their actual public services, their office buildings are only open by appointment. But if you look at their actual services, so visitor services, parks and rec, which is maybe where we align a little bit closer, right? Versus like somebody going up and paying a bill, right? Those services are open, and they've been open.
Parks and Rec is not open.
Parks and Rec has facilities open.
The cooling system place is, but the children are not in camp and they're not in the pools and things.
Right.
I understand what you're saying, but I'm gonna go back to when all of this started and Governor Cuomo was coming on every day at 3 o'clock giving us information. One of the things that he tied his stuff into, and apparently it gained some success, was how many cases have occurred and
Hospitalization.
Yeah, hospitalization. And we hear that. I listen to it every afternoon on the news with the lady from the health department. So I'm like, I'm kind of, I understand where you're coming from. And I hear what Mike is saying, that we are not the scientists, but we need to rely on, and you know that the city and the county and all of the other jurisdictions are looking at the guidelines from the health department. And one of the things that really disturbed me today was when Marcy said, and I agree with her, that by the time in the next few weeks, we're all going to know some cases. So I think Charlottesville the area has not been hit really hard, but things are happening now. I'm almost sure, well, I am in this case, I can name a couple of families that have reported positive. Have I come in contact with them? No, because I've been at home. But I mean, it's happening I think more so now than, and I'm gonna be quiet after I make this point. The schools have not even, Albemarle County, North Charlottesville has really made a commitment to opening. And I think that we will be prepared because we have tier 3 in place. I commend you, David, and your staff with what you all put together, but I'm just really kind of nervous about voting to implement it right away.
To me, there's nothing lost with collecting more information ever. And especially, let's wait to see what the Albemarle and Charlottesville have to say anyway. And putting off another meeting till Friday is nothing lost. We haven't lost anything at all. We may decide at that point to go ahead. But let's get the information first and move from there.
David, maybe I could ask, as if don't have enough to do already, between now and Friday, could we get some summaries of what jurisdictions are doing in some of these areas that are, county buildings, Parks and Rec. But if we could have a summary, I think all of us right now maybe have different levels of knowledge about, mine would be low in terms of what each of these jurisdictions were doing. That could, give us a more targeted, more focused discussion in the meeting.
And maybe, since David is kind of, I'm volunteering, maybe as board members, we could take on some of that responsibility since we are the district representatives and the liaisons with the Board of Supervisors. We could take that and share it so that there is some responsibility, I'm thinking, from our point of position to being representative of the counties and the areas in which we are representing, that we should be responsible for providing some of that information, not just to David, but to the rest of you to get a better sense of what's happening in our communities.
And obviously that applies more to Marcia, myself, and Wendy, because Albemarle is also a meeting already, yes.
Because,
we're going around in a bit of a circle here.
Yeah.
I know, I'm sorry.
No. I'm not criticizing anybody. But I think we need to make a decision about this.
It's fine. We can meet on Friday. I just still don't have a sense of what is the information that we are looking for that is going to help us make the decision on Friday better than we can make it today. We're waiting for something that's coming from the city of Charlottesville and Albemarle County. And, but then we've also said, well, we're going to rely on what the health department says. So I'm just a little confused as to what information we're actually waiting to hear. It's fine. If we want to meet on Friday, that's fine. I probably won't be able to make it. I thought we were voting on the actual plans and as opposed to, so I thought we were voting on the plan. That's what the roll call vote was for, I thought. And I actually personally feel like the staff can tell us, okay, this is what it would take for us to ramp up so that we can now be doing, by appointment, meetings with the public. So it's fine. If you guys want to meet on Friday, that's cool.
Oh, I get it. Now I'm seeing your point now.
Yeah, and maybe people will feel more confident by Friday.
David, what would be most helpful for you?
Well, ideally, what I'm looking for is direction from the board on these things. Like when you voted to say this seems like a workable plan, it seems like we can do this, and I would look for some sort of decision on when we can begin doing this. Mostly because I want to see that there's board support for this plan, that it's not just me making a decision that's going to impact the lives of our staff and our public without it being discussed in a public forum and without the board that's in charge of this library weighing in on it. So, I think there are some good options on the table here. I agree with a lot of what Carla says. I think that I'm not expecting anything totally surprising from the city and Albemarle County today. I think that as Mike said, different jurisdictions have very different needs. They have different populations. They're in different situations with COVID-19. So I think we could easily tie it back to each jurisdiction and kind of split, not move in lockstep here, but I'm looking for direction from the board on which way to go.
So I can tell you right now that Nelson County has been holding its meetings about discussing the budget and the virus open to the public. There are some limitations on what people can do within the county office buildings, but basically Nelson County has been open. So I'm not a very good one to understand the anxieties of some of the other places other than the general anxiety about opening up and changing for our staff and our patrons. I think folks from Albemarle and Louisa and Charlottesville are actually the ones who are sitting most on the front lines right now. And that was one of the reasons that I was willing to hang back a little bit and let them take the lead. Have we decided then to meet again following decisions in Charlottesville and Albemarle? And if they have not made decisions, I think we need to be willing to give direction by Friday on whether this can be implemented and in what kind of time frame.
And I'm happy to collect that information about what other local government services are doing. Most of it we have, it's just a matter of collating it.
Right, exactly. I think that would be helpful. All right, I think we will leave it that we will regroup with that information and plan to make a decision by Friday about timing and authorization from the board for David to implement the plans that he and the staff have put together. Can we move on to some new business now? I mean, some old business. I wanted to read into the minutes, actually, that the committee assignments. I really appreciate everybody's being willing to step up to the plate. And I'll just read these off briefly. Thomas Unsworth has agreed to chair the budget committee, which will also consist of Wendy Craig, Jim West, Lisa Woolfork, and me. The 5-year plan, Erica Younglove has agreed to chair that committee, and she will be assisted by Lisa Woolfork, and I will also join that committee. Carla Mullen will take on the personnel committee, as she has done for a number of years, and she'll be assisted by Thomas Unsworth and also Kathy Johnson-Harris. Wendy Craig will continue as chair on the technology committee, and I'm asking Jim West and Michael Powers to join her on that committee. And Michael Powers will take up the policy committee chair again, assisted by Kathy Johnson-Harris, Erica Younglove, and Carla Mullen. Thank you very much. Wendy Craig will take over Jane's role as liaison to the Friends. She's already serving on the Friends committee, and I think this makes a good connection for us to the Friends. And then David needs to discuss the scheduled library closings. So we'll move on to that.
Marcy, we jumped over the beta website presentation.
Oh, I'm so sorry.
Do
This
you
has
want to
been
do
a
that?
long afternoon, hasn't it?
Josh has been very patient.
I
Josh
know,
has been very patient.
I know that
Josh?
Josh has been very patient, but I wonder if there would be an interest in tabling that just so that we can give it a better attention, the full attention, and maybe next month.
Is that possible, Josh?
If that's what the board wants to do, that's fine. My concern about tabling it for another month is that this is something that Catherine, primarily Catherine, but Catherine and I both have kind of been sitting on, ready to take out for feedback for a while now, since probably the end of March, really.
Can you do this very briefly, Josh?
I will, something I can get through it by 5. And Mike, if you wanted to know any more details, I will happily send you like the full list of everything that I was going to discuss. I'll send it to David to send to the whole board. That's fine.
It's
For more detail.
Well, I think I'm going to have some comments and questions when we unpack. So, but that are applicable for everyone. So, yeah, let's do it.
Okay, sounds good. So, Catherine is here on the call as well, and I want to be clear up front that Catherine is the builder of this site. Catherine is the person who has been driving this whole thing. She is doing 99% of the work, and the 1% that other people are doing is usually me, and it's usually me doing it wrong. Just kidding. But So I'm going to go ahead and screen share, make sure I get the right window here. Share. Okay. So I am going to go through very quickly a couple of big highlights that are major changes to the website that I think make the website much more efficient, much more responsive, and thus like a better service to the public. Highlight a couple of specific pages. Going to very briefly highlight how we're going to gather feedback from the public. We've already been gathering feedback from staff, so get feedback from the public, and then briefly touch on some of the back end work and consultant work. Catherine is on the call, so Catherine will be available to answer any questions, especially some more detailed questions as well. So the first thing I'm going to highlight is here just on the front page, just the general structure of the website and how it works. Catherine has kept the design as similar to the old website as possible, with the green bar and all that, with some slight tweaks to make it more accessible. The big thing though is all of the integration of various parts like APIs and the catalog and all these cool things, integration throughout the website. So for example, you can see, of course, right here in the middle, that is a direct search that goes straight to our catalog right there on the home page, so that people don't have to make those extra clicks to figure out how the heck do I find a book on the website. So that's right there. Site search functionality is much more robust, you could say. So if you were to go in the site search and search for, let's say you're a member of the public, and let's say you want to find a volunteer opportunity, or let's say you're looking for a book that's called The Volunteer, right? You could go there, search for volunteer, and you can see here you get search results directly from the website, right? So, oh, how do I volunteer at the library? Boom, got that. And then you can also see you get catalog results as well. So maybe you were actually looking for the book called The Volunteer, right? You just go to one search. It doesn't even matter sometimes which search form the public is using. It's to get them their information as quickly and more responsive as possible. So I wanted to highlight that without going into too much detail. Let me get this window here. So one other cool thing is this website is responsive. So a lot of you are or should be familiar with the mobile website that currently exists for JMRL. This is kind of an out-of-the-box thing that is provided by III, the same people that provide Sierra. So to make any changes to our current mobile website, I have to file a ticket with this company and basically wait for one of their technicians to change the website for us. That's the way that product is designed. Of course, with the new website, it is responsive depending on screen size, right? So this is roughly what it might look like on a cell phone, right? So no need for this extra product that we're paying money for, no need for duplicating multiple things. One big frustration with managing the website right now is anything that gets changed on the website, or, you know, I get an email from David that says, please change whatever on the website. Catherine and I basically have to go find it in like 4 or 5 different locations. This new design will allow us to basically go in, make one change generally, and that's that. Much quicker, much easier to make those changes. One thing is that each individual branch is going to have a much more involved homepage for that branch. So this is Northside's page specifically, right? So all that information that a patron might want immediately about a branch is up here at the top, like who's in charge of the branch, phone number, fax, email, hours, address, all that stuff is right there, easy to find. Also, this will be a lot fuller whenever the library opens and has in-person programming again. Here is like programs today. So let's say you go, this is, in theory, somebody could check this page every single day to say, what's going on at Northside Library today? What kind of programs we got going on? And so this populates every single day. You can scroll down and see, here's all the different random services that you can have at Northside Library. This is everything Northside Library does. It has space here for specific branch-specific things that that branch offers. So Northside likes to emphasize their display walls, right? So you have images here for the art that is currently on display at Northside. We also left this one, even though this is, Catherine put this one up specific for this meeting, we can add specific branch-specific events that are going on, special events, third-party events, such as how every year you have the AARP come in and do the tax programming, right? They do that at Northside and a few other branches. So this is an example of how easy it is just to take this form and just drop it there, right there on that page's website. Before, this would be a very fiddly thing to do and kind of difficult to make it look decent on the current website. So that's one thing. And then finally is each branch has their own full calendar here at the bottom of the branch specific website. So it's extremely easy. You don't have to filter through all the other stuff. Let's say you're in Louisa and you're like, I don't really even want to know what's going on in Nelson. I want to know what's going on in Louisa. It's very easy to figure out what's going on at that branch. So that's one big example. I'm going to skip a couple of these. One that I will highlight though is the new digital library page. So as a reminder real quick, on the old website, if you wanted to find Ancestry.com, you would have to go to databases, right? And you'd have to click through a few different links to figure out exactly where Ancestry is. Or let's say you couldn't remember how to use Overdrive, right? You would have to then go and be like, oh gosh, where is it on these menus? Don't really remember where to go. The point is, it's in multiple different locations. Catherine has made this fantastic digital library page that I'm kind of thinking of as like the beta or the alpha version of an actual digital branch. And this is where all of the library's digital collections are going to be housed on this specific page, right? So let's say you're a patron and you're interested in Ancestry.com or one of the many, many databases that the library provides. It's here on this page. You can see, I mean, there's a lot of stuff, right? So it's pretty difficult to browse because there's just so much great content. But the point is, though, is that Catherine has also made these filters, right? So let's say, you know, you're like me and I don't honestly know the last time I read a physical book from start to finish, but I listen to tons of audiobooks and read tons of ebooks. Let's say I want an audiobook, right? You just click that listen button, and here is every digital resource the library has that offers some type of audio content, right? So it's a much, much easier way for patrons to come in here, filter out exactly what we have that is in a digital collection. Same thing for watch, same thing for educational material research. Also has even more specific drill downs into what other type of content is there. Let's say you're a historian wanting to find some newspapers or something like that. You can hit newspapers, filter, boom, right there. You know exactly what the library has. You don't have to filter through a giant list anymore. It's a much easier way to parse out library content. There's two other things I was going to highlight, but I'm not going to go into depth here. One thing I do want to mention, though, very briefly, is the idea of this website too is that adding and removing content to the website, it doesn't need to be such an individualized task anymore with the way this website has been built. So certain specific pages can be, and our vision will be opened up to other staff members other than Catherine or myself. So for example, Catherine built this great page for how to volunteer at the library, right? So on this page, you can see up at the top, there's a general application. I'll spare you of it. It looks like a normal application. Here's the person you contact if you want to volunteer. It's Heather Pennick, who works at the Central Branch. And if you scroll down, of course, there's, okay, here's how you can filter them. Here's the different volunteer opportunities. The cool thing about this is Catherine has it set up so that Heather can directly modify these volunteer opportunities on here. We don't have to have that back and forth anymore where Heather sends a PDF to Catherine and says, can you upload this? And Catherine says, oh, your margins are wrong. Please resend it or something like that. Heather can directly modify this stuff. So it's much faster, much easier, makes everybody a lot happier, makes the library a much more efficient creature, where then Catherine can work on digital library stuff rather than having to modify each little PDF on the website. So that said, how are we going to get feedback? This is simple. We're going to be able to do this very similarly to how we did feedback for the new catalog when we did that a few months ago. So if you look here on the current homepage, you see there's still this new page for the digital library card. That's not going away anytime soon. And there's this link here for giving feedback to find it. We'll probably relocate this one. We still want feedback for the new catalog, but we'll just basically replace this and say, JMRL wants your help preview the new beta website and use this feedback tool to tell the library what you think. Catherine and I are planning on receiving feedback via this form have an email set up where people could email one of us directly, and have a phone number set up. So make sure that we can get it from everybody. Once that feedback comes in, Catherine and I will review all of the feedback. Catherine has her the web committee that she chairs, so that they can come together, determine what to do with that feedback exactly, and then develop a plan of how to incorporate that into the beta website so that it becomes the real website, right? The live website. One thing is there is a slight concern, I think, from some members of the public. What happens to this website you see on your screen right now? What happens to the old website? We do plan on archiving that. It will become relatively out of date because it's not going to be updated anymore. But there are some things on there we know that members of the public like knowing where things are. So people have gotten used to this website over the past, decade plus. So we're not going to delete it. It's not going to go away forever. It'll probably be archived it will be archived probably at a URL, something like old.jmrl.org, something like that. And then the last thing that I have, without getting too into the IT weeds, is that there's a lot of back-end work that Catherine has been working on lately, dealing with stability, API integration, setting up a new server, which has been a fun ordeal to set up a new server. We have reached out to lots of local website consultants and server consultants. I myself personally reached out to at least, I think 6 or 7 different companies, including we did reach out to various community outreach programs, like Willow Tree has that program, and it was kind of determined that their program wasn't really large enough to suit our needs, and then other programs were too large for our needs. So we ultimately decided on a local company called Braid that has been helping us with their with back-end development. They have some serious expertise in Drupal and with Drupal server maintenance. And that's something that Catherine and I know about, but not as much as we probably need, hence the need for consultants. We still have Braid on retainer for about another, Catherine can correct me if I'm wrong, I think we have them for another 5 or 6 weeks, and we can basically call them up whenever we need them. And that's all I wanted to share. It's in our opinion, speaking for Catherine, she can correct me if I'm wrong, I think we're pretty much ready to put that beta.jmrl.link on the website, solicit feedback from the public, and see what goes right and see what goes wrong, and fix everything that goes wrong. And that's all. I think that's all I have in a truncated version of this presentation. So any comments, questions, feedback, Catherine and I are here for it.
I do have a comment. One of the things that we deal with in our county is people who are accustomed to using computers in a fairly simple way. How are you going to reach out to those people and see whether this is an overwhelming change in the website for them, and whether there are any ways to simplify it?
Yeah, so this is similar to what we did with the catalog. Is we're always thinking in terms of, web feedback, phone feedback, email feedback. We're going to have signage. This is difficult during COVID, but we were going to have signage up at every branch and encourage all branch managers, all branch employees to just ask people, when they come up to the circ desk, did you get a chance to use the new website? Do you like the new website? Things like that. I know specifically I spoke with the folks at Scottsville last week about that, that Scottsville patrons really love to just kind of come and talk to the librarians. And so it's a perfect opportunity to bring it up in conversation. That's the main way. We'll also be including it in all of Jesse Lane's communication, the public communication, things like the newsletter, all those different publications that go out. It will be in there as well. So it's really just going to be trying to broadcast as far and as wide as possible. And if there's somebody who really hates it and wants the old website, that's why we'll keep the old website around, is to do whatever we can to keep things the same for them in the way that they like it. It'll still be an available resource.
I would hope that you and Catherine might be able to do a little more active reaching out. It's very difficult for the branch staff to actually talk to people about this, especially given the restrictions that we're under right now.
Can I add one thing? any website is a continuing process. So especially once it becomes safe to actually talk to people, watch the news, that kind of thing, we will certainly be able to be a lot more active. And then once the website has existed for a while, it'll be easier to filter out what problems are actually problems and what problems are just, this is new and I'm not used to it. So I think the process of getting feedback is continual for the life of the website, basically.
Mm-hmm.
I'm concerned that the website may be overwhelming, really. And I would hope that very early on, you might try to get some feedback about whether it's enough that people are just not using it.
See, I think it has a great look, and actually the search component is going to be simplified on the new one. And we are going to get feedback just like we did on the catalog, correct?
Mm-hmm.
That's what we're going to be sharing and asking people, correct, Josh? Oh,
Yeah.
I lost. Okay, so that will be available, and it's just more difficult now because of COVID. Otherwise, you have that interaction and sending out. But maybe we could think on that. I'm sure you all come up with ways, like you said, through the newsletter and whatever, to get the feedback. And then, as Catherine said, the feedback will come in as people are using it to make those corrections.
Mm-hmm.
But if you're concerned about just making sure we get the word about soliciting feedback to as many people as possible,
Right.
one little brainstorm is just put a bookmark in with all the holds. I know we've done that sort of thing in the past. And then you've got your message in front of everybody who's getting books. My general comments. So clearly, this is a huge step forward in terms of the framework and the back end and what you're able to do with the site and how the ease of maintenance, all the technical kind of background stuff is there. This is a crucial resource for, essentially that's the way that people, aside from coming to the branch, can interface with the library. And I really feel that it's so important to make sure that we're getting the best result in terms of how we're organizing the information and presenting it, just in primarily in the home page. I mean, I love I don't want to get into start saying all the things I like, because I think that's kind of not my role to say, well, I really like the hours drop down. But just as a high level, there's a tension between, we have so much stuff we want people to know about and learn and discover, and we want them to know about all these things and opportunities that the library has. But there's a tension between, if you put it all in the front page, which is kind of the approach on the existing site, maybe I can criticize the existing site, that it does become overwhelming, and that you kind of and that you lose focus. So if you compare, the approach of something like library.virginia.edu, just the University of Virginia websites, it's just a very clean approach where there's modules, and then that kind of gives you a real intro to what what that little square, what's behind the square, and then if you need the square, you can go through it. But what I'm getting at is there are design principles that professional designers face all the time with, hey, how do we navigate this tension between too much information and presenting it cleanly and in an organized fashion. So I was actually very interested to hear that you're working with Braid, because but it sounds like you haven't worked with their design part, because they do very well design. That would be one of the people in town. I don't want to advocate any particular vendor, but if that would be on a list of in town in particular 10 agencies that I would talk to. So what am I getting at? I guess I'd like to propose that from the board standpoint that we're presenting the guidance that we feel that this idea of organization and effective presentation of the information is very important. We want to just kind of provide that high level guidance of the importance of that to the board, if that's what people agree with. And then also make sure that you're aware that, or again, as a board, that we communicate that we're willing to support that goal with resources if necessary. I mean, so far we haven't been faced with any cost benefit decisions. Hey, here's what we can do in-house. If we hire this guy, this is what we can get for it. We haven't been in a position to kind of make those cost benefit decisions, but I'd rather understand an expensive option and say, okay, we can't really do this, rather than sort of pre-filter that out up front and say, well, we never considered that option. Again, my goal is to get the best result in terms of the presentation.
And Mike said much better what I had been trying to say. I understand the difficulties of running the back end and how to manage all of the different aspects of the library that individual agents in the library need to be able to post and manage on their own. But I think the interface between the public and the library is one that really needs to have a lot of thought in terms of not making it overwhelming so that people get either distracted or intimidated by the presentation of what's there.
Can I just ask a question from both of y'all? I hear that the website appears overwhelming, and I'm hearing questions about design. For me, and keep in mind, I am not a website designer. I am also not a librarian. This website is the old website is incredibly overwhelming to me. And when I took this job over 2 years ago, I thought this was one of the ugliest websites I'd ever seen. And I was very anxious to replace it with something else. So my question is that myself and Catherine meet often, and Catherine has the web committee. And the general consensus amongst that large group of people is that this website looks good and that the website is much cleaner and much less overwhelming than the old website. So I don't understand the issues.
I guess that's why I was trying to encourage you to reach out to people that you otherwise might not get feedback from. People who might be less sophisticated in using the website and using the library. Go ahead, Wendy, I'm sorry.
I agree with Josh and Catherine 100%. I hated our other website. But the proof is in the pudding. And one thing, keeping in mind, we are going to be have the trial and see how it works and get some feedback. And also, I use a lot of other library websites, not university particularly, but I look at other public library websites quite often for comparison. And this is more of what you see, especially. But we need to do that. We need to just figure it out. We've had this, we requested that they simplify ease of use when you can have this search engine right there at the very beginning that's going to take you through all of your options on your website. That's incredible. I don't know, I'm excited, but I think we need to do the look, see, and let people respond and send out the review and let people test it out and work with it and then look at the responses. And I may be surprised, but this is what we asked them for, and it looks like this is what we've got. Everything's going to need some tweaking, but whether you wait while you're using it and tweak it as you go, or when we get the feedback from the essentially from the practice and seeing how it works, I think we'll have more to talk about. I think we're jumping the gun here.
Are there any other board comments?
I just had a quick question. I had heard that I guess there were problems getting the reading history to move to the new website. Is that still the case? Or when people log into my account, can they pull up their past reading history?
Catherine, can you answer that one? My understanding is that they can do that, but maybe something's changed.
I'm having trouble making out what you said, Carla.
It was a question about patrons being able to log in to the new system and see their reading history.
Oh, okay. I think the way it is set up now is that they have to opt in, and they have to opt in Aries, not find it the new system. And in the future, we can add some way that they can opt in or opt out. But right now, that's not built in. Does that answer the question?
Yeah, and will we
But
let
by default, it's off.
Yeah.
So I also,
Oh,
go ahead.
I was just wondering, so are we going to let people know that?
Just to clarify there, so Catherine, if they are currently opted in, can they see it in Viewfind?
I think so. I tested this a while ago, like months ago, and I no longer remember the answer.
Okay, well, we'll check on that, but Carla, I'm pretty sure that there won't be any, if somebody was already using it, they'll be able to see it. And if they want to start fresh, then we might have to do some work, but Catherine and Josh will check on that.
Okay, and then I am sorry, I'm going to have to head out, you guys. So I'll be heading out just in a minute.
Thanks, Carla.
Yeah.
I'm going to have to follow Carla as well. Do you? Because I got to go across town to another and pick up some items and then go to another meeting on Zoom.
So we have run to the end of our meeting without running out of our topics. I think it might have been predictable given the amount of work we had proposed for this meeting. I'm afraid, David, we may have to call this a quits unless you would like to give your director's report to get it into the minutes of the meeting.
Sure, yeah, it's very brief. Briefly, I wanted to say about the website that Josh and Catherine, I think, did simplify quite a bit what was available on the old website. And they did, Mike, work with Braid on the design end as well. And Braid was pretty impressed by the work that they had done before they got involved. So I'm very happy with this. I am going to suggest, to Marcy's point, that we load the new website. Right now, when you use a library computer and it boots up, it goes to the old website. I'm going to suggest that Josh and his team look at loading it up to the new one. So maybe some of the, even in tier 3 when we get there, some of the in-house computer users will get an option to see it at least. The people that need to come to the library in order to use the computer, which are some of the ones that might not have access at home. So I think that's another good way to get.
I think that will be helpful.
Okay. So we're going to skip the schedule of library closings until next month?
We don't have to deal with anything until October, is that correct? We got Labor Day.
That's correct.
Okay. If that's all right with the rest of the board, I think we can probably handle that next month a little more easily.
That's fine.
Then very briefly, I wanted to get into the record of congratulations for Megan England, who welcomed baby Finley Ray England Kunkel on Tuesday the 14th. So it's nice to have something to celebrate. Megan's going to be on parental leave for a while, and Ann Lindberg is the acting branch manager of the Scottsville branch. A sad byproduct of the current pandemic is the loss of the ability to celebrate those types of milestones. So another one that went by in May was the retirement of longtime Central Circulation employee Geraldine Powell. Jerry worked at JMRL for 30 years and deserves much more recognition than this pandemic allows. Staff are really looking forward to the day where we can take her out and celebrate. But at any rate, a 30-year employee deserves more than nobody being able to say goodbye. If you're free tomorrow at 10 a.m., our friends at the Virginia Festival of the Book, Virginia Humanities, are hosting a shelf life program with Caldecott Award winner Kwame Alexander for a discussion of his picture book, The Undefeated. It's going to be hosted by Central Library's young adult librarian, Tasha Burkhead. And last couple things, Lorenzo Dickerson has begun filming his documentary about 100 years of library service in the region. He's visited Scottsville and Louisa to take footage already. And last, for training, a few trustees expressed an interest in attending the United for Libraries virtual conference, August 4th through 6th. So I'm going to register the whole board for it, which will include on-demand viewing later, and I'll send the URL out for you. So those of you who can, great. If not, you can view.
Perfect.
And then the last bit of news I have was that Overdrive bought Recorded Books. So right now we've got these two big entities for access to online online resources that are going to merge at some point. So we haven't seen a complete picture of what that's going to look like yet, but pretty soon they'll just be, instead of Libby and RB Digital, it'll just be one thing.
Oh, good.
That's all I have.
We don't know the name of it yet.
No, it's going to be.
Okay.
I apologize, but I do have to run. I'm not near my home.
Can I have a motion for the board meeting to adjourn?
So moved.
Thank you very much, Michael. All in favor, please just as a group say aye.
Bye.
Are there any nays? Thank you very much.
Thank you all. So I'll put together a very brief agenda for Friday and post it and send it out so that we'll meet the notification requirements. And I appreciate, I've already seen the feedback. We can't actually discuss this right now. The meeting's over, but the meetings are done in Charlottesville and Albemarle. There were no big surprises. So
That's helpful.
thank you all for your time today.